In Chinese medicine is everything about diagnostics. If we can't diagnose, we can't treat. If we speak about digestion, how can we verify that digestion is not strong or stomach is inflamed? I would like to illustrate it briefly, the theory of Dr. Chang, who verifies his pulse diagnostics and diagnostics interviews with ear. Ear is such a beautiful tool to use during the consultation, and actually, to be honest, I start with the ear diagnostics. When patient comes, I take picture of every ear, left and right, apart from the blood pressure. But blood pressure is another conversation that we will speak about it later. So ear, related to digestive disorders. Helix and something like this. Okay, where is the stomach in the ear? The stomach is in here. The best way is to Google the chart, ear chart, and see where the organs are. If you see in this area redness, some irritation, it means stomach is inflamed, gastritis. If you see this area brownish, I don't have a brown color, but it will be black. Imagine this is brown. We'll put a bit of red, so that will be brown. Little spot, not exactly brown, but it's a bit like coffee or tea color. That means big stagnation in the stomach. So it needs blood movers. It needs 8+1. So if there is a stagnation in the stomach, stagnation, brown color, which treatment would we need? Big stagnation. Either first, second or third, or 8+1. If you see here the redness, it means stomach is inflamed. Not necessarily just big red spot. You won't see the big red, but you will see capillaries, red capillaries, like red spots, like very inky. So this is the inflammation in the stomach. If you do 8+1, it may cause disturbance. Especially if the stomach is hot and you see red spots here, and you decide that Jiu Yin Yang Ming is the best pattern for this patient, which is pericardium, large intestine, stomach, liver. The stomach is inflamed, gastritis. Patient is nerves. The pulses are like liver is, most of them are wiry, stomach is wiry and up. Wiry and up. And you see this area red, and there are some cramps. Don't do stomach 36. It will cause more stomach heat in the area. Do stomach 43 or even 44 and 45. And only after, when these pulse will subside and you will have a normal stomach pulse, you can add stomach 36 to strengthen it. But at the moment, for gastritis, pericardium ashy 3 and down, large intestine, if the pulse is weak, large intestine 4, for example, and liver 8 is a beautiful choice. Liver 8 is responsible for digestion. Very good combination. If you see that kidney pulse is very weak, what do? You just add kidney 7, for example, into the yin corner. I had a patient, she came yesterday for the last treatment. She only had 5 sessions. She came with pains, gastritis, and complaints on tiredness and stress. That was her treatment. On the 5th session, she said, look, I'm fine. I'm absolutely fine. So this is about redness here. If you can see that there is some redness or kind of inflammation or purple colors in gallbladder area, you think that I have to move gallbladder. For example, with Ju Yin, Shaoyang. If you see that there is edema on the earlobe, it means that edema where? Earlobe is the head. They can't think properly. They have memory problems. They have tinnitus. So the swollen earlobe. So you can adjust the treatment accordingly if it coincides with patient complaint. As I said before, always ask the patient, what do you want me to treat? I learned it from my experience. I remember the patient, very important patient to me, he came with the complaint about snoring. By the way, snoring is very difficult to treat, especially when the person is overweight and it's phlegm everywhere. So, and he also mentioned that he has a prostate problem. But he didn't want me to treat a prostate. He wanted me to treat the snoring. But I said to him, oh, you know, the prostate is a problem. Look, you have some kind of the signs of inflammation. And he mentioned, I want the snoring. But I said, no, the prostate is the problem. Look, so I started actually with all my ego treating prostate. And I did all the relevant points. So his prostate became overactive. And he had some stomach complications. I was fortunate that particular evening he went to Indian restaurant, so he complained about the restaurant and the Indian chef, but I knew that was me. So treat what your patient asked to treat. Don't treat what you think is the right for him. That's a general rule.